I'm going to bring on the folks from the Kane County Health Department, and they are in our virtual green room right now. So let's see. I'm going to bring on Kathy Fosser, the Interim Executive Director of the Kane County Health Department. Hi, Kathy. Welcome.
Hi. Can you hear me?
Yes, you are on. Yes.
All right.
And then I'm going to bring on Michael Isaacson, the Assistant Director of Community Health. Welcome, Michael.
Thank you.
And then Uche Onwuta, the Director of Health Protection. Thank you for joining us, Uche. All right, I'm so grateful to have you here tonight. I know everyone has been working around the clock on just from pandemic mitigation and now on to the vaccine rollout. So thank you for your time this evening. And I will hand it off to Michael, who has a presentation for us.
Great, very good. Thank you so much, Representative, and thank you for inviting us to join the conversation today. And I'm just going to give a few slides to provide some background and some information about what's been happening in Kane County. And then we want to allow plenty of time for question and answer with the team.
Great.
So a little bit here about where we are with COVID in our community. I usually like to share 3 data points that the state looks at when they're determining what guidelines should be used. So you may hear talk about phase 4 or tier 2. These 3 data points are what we use to determine where we should be. And the positive news is that we've been improving over the past month or so. So this is really exciting. On the left, you can see is the test positivity. So that means out of every 100 tests that we provide to see if somebody has COVID, what percentage are coming back positive? And right now in the region that we're in, which is the Kane-DuPage region, less than 5% of those tests are coming back positive. So that's really exciting. You can see from the chart, it's been a nice downward slope for the past 30 days or so. If you remember a couple months ago, we were up around 16% or more of the tests were coming back positive. So that we're down below 5% is really exceptional. On the right-hand side of the screen, you can see hospital bed availability. That's the second measure we like to look at because we want to make sure we have good medical capacity in our community. Our goal is to have at least 20% of our ICU beds available. And as you can see from this chart, over the past month, every single day, we've been hovering right around 30% capacity. The third measure that we look at is hospitalization for COVID-like illness. Again, here's good news that over the past month, we've seen a pretty steady decrease in the amount of hospitalizations that have occurred. So in the last 30 days, only 2 days were increases. Otherwise, we've been moving on a very positive trajectory. So this that I'm showing you here is 30 days. But just for comparison, I also wanted to show over since the summer, you can see what we did go through. So you can see from the summer when the number of hospitalizations were stabilizing a bit from the spring. And if you remember, this is when things were really bad in the spring right here. But then around October, we hit that really rough period going into November and December, where we had a tremendous amount of hospitalizations, serious illness, and death. So this is very positive that since then, we've been able to bring these numbers back down much lower. So for test positivity, for hospital bed capacity, and for overall hospitalizations, those are 3 areas where we're doing really quite fine.
Yeah, keep it up, Kane and DuPage County. That looks really good.
Very nice. So unfortunately, we've all lost friends, family, people we know from work to COVID. This chart shows again from the summer, you can see starting where it was coming down from the spring. We had a relatively quiet fall, but then it's important to note that the number of deaths that are occurring, that typically comes a little bit after the hospitalizations and test positivity goes up. So if you remember from the earlier chart in October or so is when we started to see the increase in the number of hospitalizations. Then in December, January, unfortunately in Kane County, and this slide here is specific to Kane County, but we were losing 3 or 4 people every day. So those numbers have started to come down. The last reporting period, we had less than 15 deaths in the week, which is still 2 people that we're losing each day to COVID. So that's too many, but we're making progress. And now that's why we're very excited to have the vaccine becoming available. So just a little bit about the vaccine, and many of you may be familiar with this, but we do have different priority groups. This comes from recommendations at the national level, and then each state looks at it and decides what's going to work best for them. So on phase 1A, which is where we started, I typically describe it as being broken into 2 groups. We have on the left our healthcare workers, both in the hospital setting and the non-hospital setting. And over on the right, we have people who are living in long-term care facilities and other congregate care areas. So this really, and you'll see this continues into the next phase as well. The people are prioritized here because in our hospital or our medical settings, those are people that we depend on every day. And because of the nature of their work, they are in jobs where they're more likely to come into exposure with somebody who may have COVID. So we want to make sure they're protected. On the right-hand side, for people living in the long-term care facilities, because they're congregate settings and because people are typically older in these facilities, those people are at more risk for not only infection, but also potentially serious illness and death. So we wanted to make sure that these were the people that we got the vaccine to first. And I think we've done a very good job in Illinois getting vaccine out to the long-term care facilities and out to our medical providers. So currently we are in what we're calling phase 1B. And this is a very large category. And I think that that's contributing a little bit to the frustration that people are feeling, just because this category makes up so many of our neighbors and our friends. The first group here is people over the age of 65. So again, just like with long-term care facilities, the older somebody is, the more likely they are to potentially get a serious illness if they have COVID and potentially die. So that group we're prioritizing because we want them to be healthy, because we're worried about serious illness. The rest of these people, the frontline workers, and typically I don't like to read slides, but I like people to understand the magnitude of this group. It includes our frontline first responders, educators, including childcare, food and agriculture, manufacturing, corrections and inmates, U.S. postal workers, public transit, grocery store workers, and shelters and adult daycare. So that's a lot of people. And besides the top, the 65 and over, which are more at risk for serious illness, all the rest of this group is at more risk because of the nature of their work. So just like the healthcare providers, many of these are people that we've depended on over the past year to show up in person and do their job so that we can keep going with our lives. We need people in the food sector. We need people making things. So we've really relied on people. And because of the close proximity that some people have to work based on the type of job they have, they're at increased risk for illness. One thing that we'll frequently hear from people, and I think this comes out a lot in the frustration right now while the vaccine availability is still relatively low, we'll hear people say, well, why don't you just vaccinate all of the older people, because they're the ones at the highest level of risk. And that does make sense. But also the frontline workers, because they're more likely to come into contact with COVID and spread it, if we vaccinate more of those people, we're actually reducing the amount of COVID that's in the community. And that protects all of us, including the older population. So we have a lot of people in this group. And if you've been watching the news, you probably saw that the governor has just expanded this 1B group. And now in about a week or so, we'll be looking at people who have health conditions as well. So this is already over a third of Kane County residents, and that's going to expand even more when we look at people who may have an underlying health condition. So that gets to one of the key things, and that is how are we going to get vaccine to all of these people? So this is a slide that's available. This is just snipped from the state website. I think this is a really fantastic page for people to be able to track what's going on in their community. Over here on the left, you can see day by day how many shots were administered to Kane County residents. So the good thing here is that we are seeing this orange line continue to go up. So this is the average number of shots that we're providing per day. So as of yesterday, we were providing about 2,700 shots per day. Now we have 530,000 people live in Kane County. So we need to be providing many more shots than that. But right now we're limited by the amount of vaccine that we have. So even though we're moving in the right direction, we're getting more people immunized every day. That's fantastic news. I always like to point out it's pretty miraculous and exciting that we have two very effective vaccines that have come to market within a year of this virus showing up on our shores. So this is really exciting that we're able to protect people. That's the Pfizer vaccine and the Moderna vaccine. They're both 2-dose vaccines, which means for the population that we have, it's not the work of getting everybody through the line, but we need to get everybody through the line twice. So we have a lot yet ahead of us. Over on the right-hand side of the chart, you can see the age demographics for the people who have had shots in Kane County. About 1/3 of the people who've received a shot have been 65 and over, and about 2/3 have been 64 down to 16, which is the youngest who are eligible to get the vaccine. Part of this is based on the type of work that people do. So again, if you remember the priority groups, there's a lot of people in healthcare and these other jobs where people are younger than 65. So we have a large number of that group. Also, when we look at health disparities, we see a lot of people in our community who are dying at younger ages if they are Black or Latinx. And that's one reason why Illinois was one of the first states to reduce the age, because at the national level, they were talking about 75 and up.
Right.
But in Illinois, so that we could better address these health inequities, we lowered the age to 65 and up. So we're making good progress. Things are getting better every day. Here's a link to the website, and we can make these slides available to people if you're interested. So to date, we've had about 54,000 doses of vaccine that have been sent to Kane County. Again, we have 530,000 people. And with our current vaccines, we need to give everybody 2 shots. So we need way more vaccine than we're currently getting. This week, because a lot of the vaccine that's coming is already allocated to people who are getting their second dose, because we want to make sure if we give someone their first dose, we want to assure that we can give them their second dose in the right time period so they can get the full protection. So this week in Kane County, for our 530,000 residents, we're only getting about 1,500 doses, 1,500 doses for people to get their first shots. So I just want to acknowledge the frustration that people are feeling. People are going to different websites and they're signing up and they're trying to register to get a shot, and they're telling us that they're having difficulty. And unfortunately, right now, that's why, is because there's just not enough vaccine in the system here in our local community to be able to provide to everyone. This is something that we hope is going to continue to change. So a couple of things that people can do now. If you haven't already done it, I encourage you to go to this link and you can sign up for our weekly updates from the Kane County Health Department. We'll share information as we learn about new vaccine that's coming to the community and where people can go. Also, we like to always steer people to the Kane County Health Department, just regular website, where there's always lots of good information, not only about COVID, but also about vaccine. We also like to let people know that we are continuing to look at special populations where we may be able to actually go out and go on site to work with people. So we're working with large employers. We're working with areas where seniors may live. It may be independent living facilities. We're also looking at factories and manufacturing where we're seeing more outbreaks and more workers may potentially be at risk. So we want to make sure we can get in and get those people protected. Over here on the right, supply and predictability should improve. I'm a little bit embarrassed because I've been using portions of this slide deck for several weeks now, and we keep saying that the supply and predictability should improve. I'm optimistic. I think it is going to get better. We're just not quite there yet. There is a third vaccine, the Johnson & Johnson vaccine, which we hope will get emergency use authorization here very soon. That'll be great because not only is it an extra vaccine that we're going to be able to use, but it's a one-dose vaccine. So that's literally half as much work that it's going to take to get somebody fully immunized with that particular vaccine. The number of providers that we're working with in the community continues to increase. So in Kane County, we're trying to engage as many pharmacies, as many medical groups, as many federally qualified healthcare centers as we can, because this is really a team effort where we're pushing vaccine out to as many places to get it as close to the residents as we can to make it as easy for them to get. So again, once the vaccine shows up, it's going to be there for people to get. And now we've been direct shipping to providers, and the state is starting to direct ship to more pharmacies too. So we're able to get vaccine into the community a little bit quicker. So here's just a look at what the homepage of our website looks like. In the upper right-hand corner, there's a little button that says vaccination appointments. So people can click on that and it'll give you a list of links. Again, right now, it's a tough time. People are finding success, but it does take a little hunting to find those appointments. But over the next couple of weeks, as more vaccine starts to come into our community, it's going to be easier and easier for people to get appointments. And then finally, we always like to encourage everybody to wear a face covering and maintain social distancing. So it's been an exhausting year. We've worked very hard. People have sacrificed a lot. A lot of businesses have been negatively impacted. People's lives have been upturned, but we're not out of the woods yet. Even though we're sick of COVID and we're ready to go back to normal, for a few more months, we need to make sure that we're taking these common sense precautions to protect ourselves. And with that, I will end the presentation so we can bring our team on and answer any questions people may have.
All right. Ending with that last point, we all should hold that graph in our head, that nice downward slope that you showed at the beginning, and continue to do those masking and social distancing, and just keep that downward slope is such a good thing to see.
Yes.
Yes. Well, thank you. That was some good information. And we did, receive some questions from the community beforehand. So we're keeping an eye on the chat. So if you're out there watching and you have a question for our panel, go ahead and put it in the chat of Facebook and we will try to get it answered. But I can ask you some of the things that have already come in. One thing which I find a little confusing is understanding where your vaccines are coming from. They're coming from IDPH, or are they coming from straight from the federal government? Can you kind of tell us about that chain of command there?
Sure. Kathy, do you want that or do you want me to answer it?
You can.
Okay, so very good. So I'll just tell the whole process. Each week, we send a survey out to our providers where we ask them to tell us what their needs are for the coming week. So we want to identify not only how many people do they think they can vaccinate, but we also ask them how much vaccine they have on hand, because we don't want any vaccine just sitting around. We want to make sure that we're giving vaccine to people who can get it into arms as quickly as possible. And the same goes for us. We don't want vaccine sitting in our coolers. We want to make sure that we're getting it into people's arms as quickly as we can. So we do the survey every Monday. And then every Wednesday, we get information from the state that tells us how much vaccine we're going to be able to request that week. So currently, they're telling us you could like this week or last week for this week. They told us we would get 500 doses of Moderna and 975 doses of Pfizer. So we then take that information. And this is a tough week to use as an example because the shipment is so small. And we look at our survey data to see what do our providers need. And we look at what we have planned. And then we allocate that information, allocate those doses. And so we either ask for it to be direct shipped or we will get it ourselves and deliver it or have people pick it up. And then we submit that formal request by provider to the state. Now we're getting shipments directly from the manufacturer in some cases, okay, or through just regular ground delivery. So it's coming in from different packing places. As you can imagine, with the weather we've had over the last couple of days, We expect some delays this week because the country's been through such a cold spell with so many storms. But we are able to either get direct delivery ourselves or have it just shipped directly to our partner organizations. Okay. But it can be coming from different places.
And is it true that there are some shipments coming straight from the federal government to providers, not even going through the local health department? That's happening.
Yes, that's correct. Like
is there
Walgreens and CVS? Mm-hmm.
Okay. And is there transparency with that? Do you know who's getting what, or is it kind of reliant on the providers to let you know what they have in stock?
So I can respond to that. So from the very beginning, we had the state program where the vaccines were shipped directly to the state, and then they distributed to the local health departments and to the providers, just like Michael said. And the federal government had an arrangement with some pharmacies to address vaccination for long-term care facilities. So these were shipped directly to Walgreens and CVS to distribute to long-term care facilities. And then somewhere down the line, with the Biden administration, they had a new program where they added some more pharmacies. So Walgreens in Kane County was one of the facilities that should receive direct shipment from the federal government. And I believe some of them did this past weekend. Finally, there's another program where the state is dealing directly with some pharmacies. And in Kane County, it's still in the works because I don't think it actually started last weekend, but the pharmacies like Walmart and Sam's Club are supposed to be included in Kane County. Each county has different pharmacies that are part of the program. You know, DuPage has other pharmacies, but have Jewel Lusco and Walmart and Sam's Club. You know, so hopefully when these actually start receiving vaccines, it would really help us out a lot. To address your question, we don't know what they get and when they get it, but we have some relationships that we have developed with these pharmacies. So some of them would actually let us know when they get a shipment. But it would be nicer if we had a notification about what they received so that we can actually let the community know so that they can make appointments with them.
Sure. So in a way, the decentralized nature of how this is happening, on one hand, allows more providers and more places for people to go. So one theory is it does maybe get shots in arms faster, but the lack of a centralized system makes it harder for us to share information with people because we don't know, you know, and that leads to the frustration of people checking websites every morning and finding out their neighbor 2 houses down got in, but they didn't. And it all just leads to a lot of anxiety. So is there a thought that the state will have a centralized system soon, or have you heard anything about that? A centralized place for someone to sign up? No?
They have a bunch of links on the IDPH website that people can click. Unfortunately, there are no appointments. So, you know, our community members complain to us that they click on the sites, but there are no appointments. So, you know, it just addresses the fact that there's not enough vaccines, enough of the vaccine to go around. So right. Hopefully, as Michael said, you know, things will get better in a few weeks and there'll be more availability.
Right, right. We're waiting for that supply. So talk us through, we're getting the vaccines and that will happen soon. Any side effects, or can you speak to vaccine reluctance, or, you know, talk to us about how important it is for us to get the vaccine right now?
Yeah, I think that it's kind of a war on two fronts, I think, in a sense, that we right now have tremendously high demand and not enough supply. So we're working very hard to get the vaccine to people. We also know that once we meet that initial demand, we're going to have a lot of work to do to get people who are hesitant right now to encourage them to get the vaccine so that they can be protected and protect others around them. So the vaccine is very safe. It is something that we've had really good luck with, and nationally we have not seen a lot of adverse reactions. Locally, we haven't seen a lot of adverse reactions, so people are feeling quite good. I have two of my children work in healthcare. They're fully immunized. They feel great. After the second dose, some people are reporting that they feel under the weather for a day or two. But that's just your body's immune response. So that's a good thing that happens. So we're excited to see that. But it's a safe vaccine. Both the vaccines we're using now are highly effective, very safe, and we desperately need people to get vaccinated. So we're trying to get it to as many people as we can that want it now. But for those people who aren't quite sure if they want to be first, we want to make sure that over the next few months that we can give them the information, hopefully that they'll be able to make the best decision for themselves. And we hope that is if they decide to get vaccinated.
Yes. Yeah. Great. Let's see. Another question we had. Have you finished? We're finished with 1A, vaccinating 1A fully here in Kane County? Not quite?
Not quite.
Yeah.
Okay.
We're getting there. What's happened is we still have some healthcare ones creeping in, and then the biggest one is the parents that are taking care of, those with disabilities.
Mm-hmm.
And so they're trickling in, but we've been told by the staff that we're almost through them, but I wouldn't be surprised if we still have more come forth.
Yeah.
So
Okay. Okay.
so we're getting there. We feel good.
Good.
And we also expect that, people who were hesitant at the beginning are probably gonna, I know I heard people say, well, I don't want to be the first in line. So 2 months into the program, they might be ready. And we have to have an open door policy and accept them whenever they're to vaccinate. So I don't think we'll ever finish 1A or finish 1B. It would be 1A plus wherever we are.
Yes. And in 1B, you have had success vaccinating our educators. Is that correct? Tell us about that.
Do you want to tell about that, Kathy? Or you want me to?
Yeah. Do you want to tell about our collaboration with the school districts from the beginning?
Absolutely. So our school districts have been strong partners with us since the spring of 2020 with trying to keep illness away from our kids and away from the staff. We've been working very closely with them. We meet every week with the superintendents to make sure that all the right measures are in place to protect people. Our goal is to bring as many of our kids back to in-person school as quickly as we can. We know there's social interaction and things that are really valuable. So we met with the superintendents and another great partner, the Kane County Regional Office of Education. And over the past week, we vaccinated about 12,000 educators. So we feel really good about that, being able to take care of that population, allow them to feel safe returning to work each day. And for families who struggled with remote learning, this is just great that they can feel a little more comfortable too, knowing that there's opportunities to get the kids back into school.
Yeah. As a parent to 3 children in Batavia Public Schools, I know we were also grateful when their teachers shared, I have an appointment. My daughters are at Rotolo, and I heard both of their teachers announce on a class Zoom, "Oh, we're getting our vaccination tomorrow," and you could just hear the relief in their voice. So it was a great undertaking to start that. Are there any plans in the works? I know supply is not there yet, but for other max vaccination days at the Kane County Fairgrounds, do you have hopes and dreams for some other events?
We do, yeah. Over the next couple of weeks, we'll be doing things where we're going to take care of some of our early childcare providers who also have been in the classroom, many of them through this entire process, through the entire COVID pandemic. We want to make sure that we are creating plenty of opportunities for the senior population, including people who may have struggles with technology. So we know that there's a lot of seniors who any of us people are complaining about trying to navigate all the ways that they can go in and make an appointment. So we want to make sure that for those seniors who aren't using computers, that they're plugged into some of our community partners. We're working closely with Senior Service Association and Age Guide, as well as our townships and our libraries and other partners to actually assist seniors to sign up to make their appointments. And so we're setting aside specific spots for them. And then working with other partners such as yourself, we want to make sure that we're getting to manufacturing plants where people may be at higher risk of exposure to make sure that we're protecting people and really looking at this with a health equity lens.
Yes, we are appreciative of that piece. You know, our frontline manufacturing workers here in Kane County, they were providing essential services for us throughout the pandemic, and often at the beginning going to work without the PPE they needed, and they've been putting themselves and their families at risk. So I appreciate how you're working with our office. So, you know, when you're exploring these new options for seniors, keep in mind your state legislators, because you can help spread information and education and get you the arms that you need. That's great. Let's see, another, you know, is there a phone number for people to call if they don't have access to the internet for booking a vaccine, or do they just sort of call Walgreens themselves, or a centralized number maybe?
Typically, when I'm speaking with a resident just about where they may be able to secure a vaccine, I'll talk to them about where they typically get their health care, because they may be able to get it through their healthcare provider, depending on their age, depending on their health condition, et cetera. We may talk to them about pharmacies that they have an existing relationship with, because they may be able to sign up there. And in either of those cases, those places are used to working with people over the telephone. But also if we're working with clinics, or as I mentioned a moment ago, senior services and groups like that, people can call there and they can ask for assistance to get added to lists. Okay.
And that brings up another question we had. People who are going through their healthcare providers, you know, like a Northwestern Medicine or a DuPage Medical Group, do you know how they are moving down their list to call people? Are they going by age? Are they allowed to kind of look at comorbidities as they call people, or is it the first come, first served basis? Do you know?
I do know on the Northwestern Medicine website, it does say that it goes by age, and it's if you've been a patient in the last 18 months. And
Okay.
then we were told with Rush Copley that it's 3 years if you've been a patient in the last 3 years. And then I was just told by Advocate Aurora Sherman Hospital in Elgin that they do 2 years if you are a patient in the last 2 years, and that's in any of the Advocate Aurora clinics.
Okay.
So, but
Okay.
they didn't say, I mean, they didn't say if it was by age or anything like that.
It's for 65 and up.
Oh,
They're
yes,
not vaccinating
65 and up.
under
Right.
65.
I'm sorry. Yes. The who's in 1B, which is 65 and up patients. Yes.
Okay. Let's see if I had any other questions from the community. So we are expecting 1B to take a little bit longer to get through because we have expanded the parameters for 1B also. So do you have a time? These questions are so hard because there's no supply quite yet, but are you shooting for end of May to get through 1B, or I mean, is there a timeline?
I think it's really difficult to estimate how long it will take us to get through 1B. But I can tell you that Kane County Health Department, we've had large clinics that we vaccinate 1,800, 2,000 per day. In addition to what the pharmacies are doing and what the hospitals, all 5 hospitals in Kane County vaccines, the federally qualified health are receiving several doses of vaccine. So if we had everything working the way it should work, we would be able to estimate. But right now, given what we just said about, Michael mentioned that we had 1,500 this week. Next week, we're expecting 500 first dose. So that's not even one clinic for us. So that is the challenge. It's really difficult to predict.
So as we sort of wrap up, trying to give people some hope. Right now, frustration is high and anxiety is high because the supply is not where we need it to be. At the federal level, we have been promised an uptick in vaccine distribution, and we have yet to see that. But like Michael said, we're hoping and we're confident that it will get there. So basically, I want to leave people with some next steps. It really is just to continue to check your website and continue to check in with those providers like Walgreens and Jewel Osco. And I have a plug for our office. You can call our office. We have our district director, Miguel, picks up the phone at all hours and we can help. There's our office number and our office email. You can just add us to your list of people to call for information. And I think partnering together with our local health departments, we'll try to get the information out to you as soon as possible. Do you have any next steps for people or parting words?
I just think it is going to get better, and there is light at the end of the tunnel. So vaccine is coming. We're going to get enough for everybody who wants it. We want you to want it. So we want to get those shots into people's arms. And I myself, I can't wait to go to a concert or go and hang out with a bunch of friends in their house. So I think we're on our way.
So we met COVID in 2020, and hopefully we'll be saying goodbye to it in 2021.
Yes. It'll be a nice goodbye party. We can all have it together. Well, I really thank you, for coming and speaking with everyone. This recording will be available on our Facebook and our YouTube for people to access this information. And you're the face of our healthcare here in Kane County, and you've been working very hard during this pandemic, and we're grateful for you. So we do have your website right there too. And I guess that's it. So thank you for joining our Facebook Live tonight. And I will go ahead and end our broadcast and say goodbye. Thanks for joining us, Kathy and Uche and Michael. We appreciate you.
Thank you for the opportunity.
Thank you.